Now, the DNA of ours and the bacteria is super coiled and entangled into a very small area, a very minute fraction of the bacteria. This leaves more space for other proteins and other mechanisms to work. Now, once the bacteria needs to use this portion of the DNA or the entire DNA, whether the bacteria wants to synthesize something or to make a copy of the whole thing, it has to unwind and untangle the DNA. Now, this works by an enzyme called topoisomerase. Now, the enzyme has many different versions, mainly topoisomerase 2 and topoisomerase 4. These enzymes will untangle the bacterial DNA, and the bacteria can make a copy of the DNA or use it. The medications that end with the ciprofloxacin are of the class fluoroquinolones, like ciprofloxacin and levofloxacin. These basically inhibit the topoisomerase enzyme. So they inhibit the bacterial unwinding of the DNA and inhibit the bacterial access to their own DNA. Most of the bacterial antibiotics work by inhibiting a specific structure in the bacteria or inhibiting a specific protein or a cell wall component. This limits the antibiotic to a specific group of bacteria. But all bacteria have DNA, and fluoroquinolones work by inhibiting the DNA, so they can be used for pretty much all infections, including Pseudomonas. And interestingly, the medication Moxifloxacin is most effective for COPD-associated infections. This is a common target for questions in exams. So Moxifloxacin for pneumonia and COPD-associated infections. Fluoroquinolones can cause tendinitis and tendon ruptures. So they can cause inflammation of the muscle tendons and rupture of the muscle tendons. We see this mainly in bimodial age groups, which means in children and infants and in elderlies. They also cause inhibition of the cytochrome P450 in the liver, mainly ciprofloxacin. Like we said, fluoroquinolones work by inhibiting the DNA gyrase, which is a topoisomerase enzyme. Now, the bacteria can change the structure of the enzyme by changing the DNA that codes for this enzyme. And this is how resistance develops, along with drug efflux.